This is NDTV, and you're watching Classics.
Hello and welcome to the Unstoppable Indians. Every week we take a journey into the life of an outstanding Indian, a person whose talent, acumen or moral example is transforming India. The best, the finest from every field join me, Manvi Dhillon, on this show to share their life story, their journey to success, some of the knocks along the way, what made them get up and keep going, what makes them an unstoppable Indian. My guest today is Dr. Abhay Bang, founder of SEARCH, Society for Education, Action and Research in Community Health. His work began right here in Gadchiroli in rural Maharashtra. Gadchiroli is the most backward region in Maharashtra. In the mid-1980s, the district was a public health disaster. A slow population growth hid a grim reality. A very high child mortality rate, 121 deaths for every 1,000 births. Abhay and Rani Bang, both graduates of the Johns Hopkins School of Public Health, chose to work in Gadchiroli simply because the need here was the greatest. Over the last 25 years, the Bangs have researched local healthcare issues, identified the causes of infant mortality, and devised a strategy for reversing it. Today, the infant mortality rate is less than 30. Dr. Bang, thank you very much for joining me on the Unstoppable Indians. It's a pleasure to be here in Gadchiroli particularly. Thank you for making the time. You know, you graduated from the prestigious Johns Hopkins University School of Public Health in the US, and then you chose to come back here to Gadchiroli. Why Gadchiroli?
Well, partly it was because of the Gandhi's message and influence on my life, and that was really go back to the villages of India where you are needed. So in the first instance, we went to US and went to the Johns Hopkins to come back. Gadchiroli at that time was newly carved out district in Maharashtra because of its extreme backwardness. Half of the population is tribal, district was remote. So we thought anyway, if you want to work, better go to the place where you are needed most, where there are a lot of problems to be solved, where people need your help, rather than going and opening a shop, medical shop in New Delhi or Mumbai, where you yourself become a problem. Better go where there are problems to be solved, when you are not a problem. That's how really Gadchiroli called us.
When you came here, what was it that you saw around you among the local population as medical professionals?
Look, nearly 1 million population, half of them tribal, 3 big rivers from 3 sides of the district. So during rainy season, everything used to get cut off, a lot of dense forest. And so as you can expect, poverty related disease, infection related disease, malaria was rampant, tuberculosis, child mortality, women having serious problems, sickle cell anemia particularly common amongst tribals, women having obstetrical problem, gynecological problem. So there was no dearth of problems.
And yet you zeroed in, you focused on infant mortality, child mortality, and I want to describe the circumstances of Gadchiroli here in the mid-80s. It had the best family planning record in Maharashtra, and the reason was actually a very sad one, because the infant and child mortality rates were so high. Is that why you chose to focus initially on that?
Well, it was ironical that while family planning was pushed very aggressively, child mortality was ignored at that time. We did not really come with a specific objective of working on child mortality, but it was by listening to people that we identified some priorities which people felt they needed some help. One, women said, one problem, they had enormous amount of gynecological diseases. Government was providing care for family planning, but what about their gynecological problem? Second problem, they mentioned that their men drank alcohol and became wild, wasted all money. So alcohol and alcoholism was the second problem, and their children did not survive. So we established measurement system in nearly 100 villages as to how many children died. And in the first year, when we measured accurately every birth, every child death, we estimated that the infant mortality rate here was 121. At that time, the national infant mortality rate must be around 80. So, this was 1.5 times more than national average. It was a serious problem. Even senior government officers' children used to die here, so nobody wanted to come here.
And were you able to identify the causes?
Well, the causes that we investigated, we tried a method called verbal autopsy. Child is dead, but then later on you go and you inquire into the causes, and we found the main causes were A, childhood pneumonia, B, newborn mortality. A large number of newborn babies were dying. C, malnutrition. 4, diarrhea. So, I would say that 90 to 95% of deaths occurred mainly because of these 4 causes.
And relatively speaking, they can be easy to address. But you know, when you started out, it's not like you had all the wherewithal, the finances, the manpower that you needed. So, you know, I want to understand how you actually took those initial steps, because listening to it, it seems like a daunting task.
Look, there is a very beautiful Chinese poem. It says, go to the people, that's what we did. Listen to them, love them, live amongst them, begin with what they know and build upon what they have. So, once we identified these priorities, then let me take one example. Pneumonia in children responsible for nearly 25% of child deaths, and it requires 2 simple things. Somebody to diagnose a child with cough that this is pneumonia or not, and secondly, one antibiotic, and you can save the child. Now, the major issue was who would do this. So, again begin with where people are. Now, there were no doctors, there were no nurses. So, we started training ordinary traditional birth attendants, DAIs, and village health workers to diagnose pneumonia in children. How do you do that? You need to count respiratory rate, but the illiterate DAIs, TBS were unable to do. So, we developed this simple instrument called breath counter. There is a 1 minute sand timer here. For every 10 counted breaths, she has to move a bead. Before the whole sand passes, that is before the 60 seconds, if the red bead is moved, it is pneumonia. Now, the worker, the TBA does not know how much it is, but we compared her diagnosis with a doctor's diagnosis using stethoscope, 82% correct. So, using this type of simple methods and using the manpower, or rather woman power available in the villages, we developed simple solutions for the problems which otherwise used to kill children.
When did the results actually begin to show, the positive results of your work? How long did it take?
Almost 3 years. 3 years. It took all those initial problems, including floods and some breakdowns and something. I don't have to really tell you all the stories. There were horrendous stories of initial period. But then by the end of the 3rd year, we published our first study on gynecological problem in rural women in Gadchiroli, and that turned out to be the world's first study done in developing country as to what proportion of women in villages have gynec problem. 92% had gynecological problem, as if we had unearthed and hidden iceberg. Second was our child mortality. We started managing pneumonia in children, and within 3 years the pneumonia mortality rate reduced by 76%. This was published again in the paper, medical journal called Lancet. And so, a small unknown place, Gadchiroli, but suddenly started throwing up new information, knowledge, insights and solution on the world canvas. Some of these studies became world pioneers. So, I would say it took 3-4 years to start getting the results.
And you know, today of course the government is trying to replicate the Gadchiroli model across the country, particularly in those areas that need it the most. Are you optimistic about that?
Look, the solution which we have subsequently developed is on newborn deaths. Newborn mortality now constitutes more than half of child mortality in India. Every year nearly 10 lakh, 1 million newborn babies die. Now, there are no neonatologists around. People are unable to move their sick newborn from home to hospital, which might be 30, 40, 100 kilometers far. So, we developed a simple solution, selected a literate village woman whom we call Arogya Doot, and then trained her to become a village level neonatologist. and we give her this bag which contains all equipments which are necessary for her and some information and records, and she carries this bag on her shoulder and she becomes a mobile hospital. She can convert every home and hut in rural area into a newborn care ICU by taking this bag with passion in her heart, knowledge in her head and skills in her hand. So, this simple solution called home-based newborn and child care that we have developed has a potential of reducing, proven potential of reducing child mortality by nearly 70%. Government wants to introduce now this on large scale because India's infant mortality rate is around 58. Government wants, the national goal is to reduce it to 30 in 5 years. Probably except for Gadchiroli model, this model, search model, there is no other proven solution which is as effective. The most hopeful thing is A, government is willing because there is national challenge. B, planning commission has in the 11th 5-year plan has already selected Gadchiroli model to become the mainstay of child survival program in India. And C, I would say the new health worker which government has introduced, worker called ASHA, one woman health worker in every village, which what we had done 10-15 years ago. So, if ASHA is there and now nearly 6 lakh ASHAs have been selected, there is one ASHA in every village. So, if there is ASHA, then there is ASHA that this model can be replicated elsewhere.
Okay, search today. It's gone beyond infant and child mortality issues to de-addiction, all of the issues that are coming out of community health in Gadchiroli. It's difficult to prioritize. How do you prioritize? Because I'm sure now there is trust that the community has in you, and you must have a whole host of medical issues to tackle. How do you prioritize which ones to address?
Look, we use a very different method which probably no researcher uses, and that method is listen to people. Now, this very place where we are sitting is our tribal darshan, and every year one tribal health assembly is organized here, and tribal leaders, women, men from nearly 50 villages assemble here. We hold 2 days meeting and we ask them what you think are your health priorities and what you think SIR should do next. And let me share one secret openly with you. This method is more productive than going to any library, having any medical consultation or having any academic workshops in big cities. People have more ideas and more problems and they open new frontiers. So, first method, listen to people.
And that's
though you are right really, though it appears easy, to us really it appears very easy. What does it take? Go with open heart, open mind, sit with them on the floor and talk to them. Time magazine 3 years ago, Time magazine in the US had selected Rani and me as the heroes of global health.
Yes.
And on the write-up that they wrote on us, they gave the title, The Listeners.
Yes.
As if it is a very difficult task. Everybody can listen.